Hey everyone, welcome to this explainer. Today, we are diving straight into an absolutely massive move in the Indian healthcare space. We're talking about Aster-Quality Care's whopping 1,661 crore rupee investment in Kerala. Now, strategic capital injections like this, they don't just sit quietly on a corporate balance sheet. They literally have the power to transform the day-to-day lives of millions of people. So let's just jump right in and look at the data. 1,661 crore. I mean, it is so easy for a number that huge to just kind of wash over us, right? It just looks like another long string of zeros in the morning financial news. But actually, scratch that. This specific figure is a huge deal. It represents one of the most aggressive, most concentrated physical healthcare expansions we've seen in recent history. So what's happening is Aster-Quality Care India is funneling all of this capital directly into Kerala's healthcare infrastructure. And I want to be super clear here. This is not some routine, standard operational budget increase. No way. This is a really bold statement of intent. They are clearly seeing an urgent societal need here alongside a real structural opportunity to build up serious capacity right from the ground up. But, that brings us to a really interesting question. How does a flashy corporate press release actually materialize in the real world? To really get it, we have to move way past those boardroom approvals and start looking at the actual concrete blocks, the surgical robotics, and most importantly, the real human lives that this money is going to touch. Because ultimately, the absolutely crucial question we have to ask is, what does this actually mean for the patient? Well, a fraction of this massive capital translates directly into, say, a brand new state-of-the-art ICU bed. Another fraction becomes an advanced diagnostic imaging machine. It's literally taking this abstract corporate wealth and turning it into brick-and-mortar facilities. And that's what saves patients from having to travel hours and hours just to get specialized life-saving care. And they aren't just pouring all these funds into one single mega project either. It's actually a highly strategic, totally multifaceted approach. This capital is going into constructing entirely new hospital campuses, it's funding absolutely vital technology upgrades for their existing infrastructure, and it's driving the targeted expansion of highly specialized clinical facilities. It's basically the whole shebang. So when we really break it down, the tangible assets they're deploying are super deliberate. First off, they're scaling up physical hospital bed capacity, which is, the obvious but entirely necessary first step to just treat more people. Second, they are rolling out some seriously advanced medical technologies for much more precise care. And finally, by expanding specialized clinics, they're making sure that patients with really complex conditions can find expert treatment right there in their home state. Okay, so now you might be wondering, why focus this immense billion-rupee-plus capital specifically on Kerala? Well, Kerala is really unique. It boasts incredibly high human development indices, which is amazing, meaning people are living a lot longer. But that also means they require more complex long-term care. Add to that the fact that Kerala features a really dense, evenly spread out population, rather than just like one single urban megacity. So addressing the health needs there absolutely requires a highly distributed, well-connected network. It's kind of like a giant puzzle. The demographic reality of those dense populations creates this massive, ongoing physical capacity challenge. And Aster is answering that specific piece of the puzzle with scaled-up physical facilities. At the exact same time, there's this sophisticated, constantly growing demand for advanced medical access. So the solution there lies in those high-tech clinical upgrades we just talked about. It is honestly a textbook example of private supply stepping up to meet a very localized public demand. And just to be perfectly clear about what we mean by advanced healthcare infrastructure, to deliver this level of specialized care, the physical buildings and the cutting-edge medical tech have to integrate totally seamlessly. This kind of advanced, connected infrastructure isn't just a nice-to-have. It's a completely non-negotiable foundation for a population that is rightly demanding consistently better health outcomes. But here's where things get really fascinating. The impact of a 1,661 crore investment simply refuses to be contained within the four walls of a hospital. It creates this massive ripple effect. When a corporation injects capital of this magnitude, it permanently shifts the economic and social landscape of the entire region. I mean, the impact reaches so far beyond just the immediate medical facilities. Think about it. This ripple effect brings serious, sustained job creation. And we aren't just talking about doctors and nurses here. We're talking about massive contracts for construction crews, IT professionals, and vast supply chain logistics. Plus, an upgrade of this sheer size elevates direct patient care standards across the board. It basically forces the entire local market to step up and adapt, setting a completely new, elevated benchmark for Indian healthcare as a whole. So I'll leave you with this final thought. When private entities deploy capital at this kind of massive scale to build foundational public health infrastructure, we really have to ask ourselves, how is this going to alter the fundamental baseline of medical care in India over the next decade? It's just such a fascinating intersection of corporate strategy and real, tangible human well-being. Thank you so much for joining me for this explainer today, and as always, keep questioning the numbers behind the news.